context is important to me. And the report, so far as the scope is concerned, boundary is concerned, so how comprehensive it is. And accountability, accuracy, completeness, and comprehensibility. So these are all certain principles. So far as the most important conceptual issues of GRI is concerned, materiality. So how this particular issue is important to me, because not all issues are important to any company today. So how, like if I am talking about water, or if I am talking about sanitation, if I am talking about education, or if I am talking about one particular issue so far as the climate change is concerned, so how that issue is important to my company, and this is where the issue of materiality comes in. And same kind of a thing again applies so far as the reporting in the not-for-profit sector, or GRI NGOSS is concerned. So we have started this GRI reporting in the year 2010. So that was the first year. So we have published our first ever GRI report in 2011. So which is again, which is GRI G3, category C, which is again self-declared. So we didn't go for GRI check, or we didn't go for assurance. Even though there are some people would like to come forward as sustainability assurance providers, and they were saying that we will do the assurance for your report. So that was the time where some of these big company, big audit firms, like you have when it comes to assurance, so you have KPMG and Ernst & Young and DNV, so who are very actively doing this assurance. So they said, we'll provide you the assurance. But we said, no, we are not going for the assurance, because assurance is again costlier. So that's where we didn't go for assurance. So it was a self-declared report. Now in the subsequent year, we have again gone for the GRI report, and in the GRI report, so we have followed the same methodology. Again, it was self-declared. So we didn't go for any assurance. So in the third year onwards, we didn't go for exclusive GRI reports, because we thought two difficulties. One, when we are approaching the donors, or when we are sending our documents for funding support, or for some kind of a programmatic support. So the first thing which we used to get is 80 pages report. So even the office assistant who was doing the photocopying of these reports used to say that, sir, itna karna hai kya? So the 80-page report, so which we used to send as an annual report with all GRI indicator protocols, is something which was seemingly not welcomed by the donor agencies. So they always used to say that this big annual reports who will read. But we stick to the principles of GRI. So that's where we thought, let us somewhere bring down our reports. So not in the indicator protocol way that the GRI reports are generally done. So that's where we have adopted the principles of GRI and started doing our reports. So the reports have been qualitatively and quantitatively different, and we have taken the principles of GRI in terms of management commitment, governance. So the governance, programmatic effectiveness, gender and diversity, public awareness and advocacy, resource allocation, ethical fundraising, labor and management relations, because labor and management relations are not there in our organization. So we talk more in terms of the volunteers, and also in terms of our project staff, and also in terms of our permanent permanent employees, and prevention of corruption, which is also one most important thing so far as the not-for-profits are concerned. Now, what it has given to us. So it has definitely not given so much money, definitely yes. So we didn't get so many projects on the basis of our GRI report. It was only through our implementation methodology, but it has created lot of advantage as an organization. We could able to monitor our performance year on year in terms of certain numbers, in qualitative numbers. So we can even measure what is the rate of training that has been provided to the employees, and what is the number of increase so far as the women employees are concerned, and what are the policies that are put in place so far as monitoring and evaluation of our projects is concerned. And that is where, as an organization also, Ramki Foundation evolved. So it has created a lot of positive image, even in terms of the adversities which our company has gone into. Foundation keeps bagging projects, keeps bagging awards. So even our management was astonished at some level that the company is going through some kind of a scrutiny in the public image. So people are saying that your company is bad, your stock prices have fallen. The company has done some kind of laundering. Yes, but still, the foundation point of view, GRI report as one thing, so which has enhanced our image. And this report has made our board of trustees meet every quarter. Otherwise, our board was entirely comprised of people So who are all belongs to the promoters family. So they were not coming earlier. So with the GRI reporting, so we put certain things in practice. So now our board of trustees take a lot of initiative in terms of conducting our quarterly meetings. So they attend the quarterly meetings, they give their inputs, and we also have independent nominees in our board of trustees. So these were all certain things which was practiced by our organization. So we are not so big, but definitely so far as impact of this particular reporting is concerned, so we have done considerably well. So that's where I thought I would share my experiences. Definitely, it has enhanced the transparency and it has improved the dialogue between organization and its stakeholders. And it has also, in some respects, so it has also made us as a good implementation agency. Because I just tell one small example. So 2 years back, we have applied for a project with Orissa State Finance Development Corporation. So this was a project where we don't have a very strong presence in the state of Odisha at that point in time. So it was for an impact study of the schemes which has been implemented by the government of Odisha between 1994 to 2004. So we have just applied for it. So we have called for the meeting subsequently, and it was all went in, and we have got this for doing the study in about 13 states of Odisha. So we thought it was all because of the strength of profile of the people, it was all because of the proposal which we have submitted, or the organizational backup, or the kind of financial turnover that foundation has. Because some projects, they also ask for financial turnovers, etc. So like after we got the project, when we sat in the discussions, so the general manager said that, I saw your report, so the report was very good. So it was very comprehensive. Though I didn't understand certain dimensions of it, but definitely I felt that as an organization, your report, your documents were entirely different. So that's where we thought we would go with you. So that's the point where we thought that yes. So the CSR reporting which we were practicing, or the CSR reporting which we are doing, is definitely good in terms of enhancing our own internal systems. So that's how it was. And once again, extremely thankful for having been invited here and also being part of the distinguished panel. Thank you so much.
Thank you, Dr. Harish. It was a very, I think, very in-depth reporting itself. So I think people have learned a lot. Any questions? Can you introduce yourself and then?
I am Janaki Mani, and I am a student of CSR. Yeah, ICP in CSR. I just want to understand, you said materiality is about to the organization and the company. What is the organization and the company? Normally it is to the community or the other stakeholders, right? So I didn't understand that.
The materiality more in terms of the company, in terms of the organization, like how the company treats that particular issue as material to them.
Company in the sense Ramki?
Ramki, or any company for that matter. So I was talking materiality as a principle.
No, because you said company and also organization, so I got a bit confused.
No, I was talking from the point of view of a company and also a corporate foundation. So
Okay.
my words have been like, probably I was trying to have...
So it's from the company and...
yeah, it is for the company and also for the foundation, because we also have certain initiatives, so which is also part of the supply chain strengthening. So we work with rack pickers, we work with the women in our company operated area. So that's where the materiality issues are defined, both for the company and for the foundation. Thank you.
Thank you.
Thank you for being here. We know how much time we With the permission of the chair, can I speak a line, please? The importance of Mr. Harish's presentation is with respect of what is going to happen in future. You all must be aware of the fact that SEBI has made sustainability reporting, that is the business responsibility reporting, mandatory for the top 100 companies. This is just a start. In the future, all the company would be made to do a mandatory sustainability reporting. And that's the relevance, and it's time now for all organizations to have a grip, start experiencing and learning from organizations who are already doing it. And that's where we thought in a conference like this, we should have a speaker who could share it. Maybe somebody would feel, we don't do it, but maybe the CSR wing must not be doing it, but the sustainability wing must be doing it. Go back and check. You will be surprised to know many of the public sector enterprise sitting here, you have A rating. So that's the relevance I wanted to speak.
So now I request Ms. Anju Chaudhary, who is Senior Manager, I think she's speaking on water management, CSR.
Good morning, all of you. Nice being here, being with the panel and interactions. You all, I think like last 2 days, you all had a lot of information on CSR, different aspects of CSR. Now I would like to share the practical experiences what BDL had in working ahead with CSR. Initially, like CSR started in 2011 with the guidelines, but BDL, we were from 1999 onwards as a philanthropic aspect, we were working on CSR. You see, like guidelines have come to give us some clear directions, as we have heard now, like how sustainability can make us, like a reporting system will help us. Similarly, these guidelines has given us a specific direction. Before that, like it was totally a vague, like how we are going about with the work. Now it's being clear-cut inputs are given, how much is the budget, how we have to go, how we have to choose the agency, how the project should be taken up, and the moment ahead. So in 2011, a separate section was established in BDL to work on this CSR. Earlier it was like we have SC, ST, OBC associations being in public sector. Many associations are there who are working on a philanthropic mode. Later we have established a small section to work ahead on CSR. Initially, taking the projects was, not initially, when I say like even today, the basic difficulty for any organization is to choose a project. And on choosing the project, then which is with the agency to support us. These two are the major criteria and the difficult areas which we have to face. Once we choose the right project and the right agency, the process will go ahead. So in such a scenario, in 2011, National CSR Hub was come into place, and the government have suggested us that we can take help of CSR Hub for identifying the projects or getting the baseline done, or the further process. So it was really a great support for public sectors then who are at the initial stage to take up the work. Then we have taken the support of TIS to do the baseline. So any project, what I suggest is, like, unless we have a thorough baseline done, even the present guideline says if baseline is not required, you can go ahead with a need assessment. So need assessment also, we cannot really go with the reports, existing reports or what already had. We just have to get it done or have a thorough report on the requirement of the specific public over there before choosing the project. So that report what we got from the baseline has helped us to take out a very good projects which are running even today. Like after the span of 4-5 years, we are going ahead with those projects. I'll be telling you on those projects also. So the TIS has done the baseline, and we were able to identify the basic requirements of the area. So the other end, what we have to do is, what are the areas which we have to, the next slide please. So what are the different areas what we have to choose is the first criteria what we have to choose, nearby our organizations. Then going into those areas, identifying the projects. So we were able to, we have chosen Nalgonda district because and we are in Hyderabad, and such BDL have no specific boundary that which local area is affected. So we are into totally a different manufacturing sector, and locals are not affected with our manufacturing process. But still we have gone to nearby affected area with regard to water, pollution. What we found is Nalgonda. So we went to Nalgonda and we have identified 2 districts. So we have done a thorough study in those districts, and we found that, to our surprise, Nalgonda is very near to Hyderabad, but still we found that there is lack of water. There is lack of sanitation, lack of education. Lot many areas are gap. We found that it's required, the immediate action can be taken. Next slide, please. So to that process, what we identified is the health and water is major areas which require in Nalgonda. So projects are identified. The next phase for any organization is how to choose the agency. Agency is not that easy. We have heard right now, the Ramki is doing so much of work, we are literally not very comfortable to choose the agency and to assign the work. So what is that gap between the organizations and the agencies? Agencies are already there who are excellent performers. Organizations are in need of agencies, but there is this gap to be bridged up. That is not really happening, because the TIS has supported us to do the baseline and to give us a list of organizations then. In 2011, it was a guideline that we can go with TIS and identify the agencies which are enrolled with them. So that made our task very easy. So we have gone into the TIS site, we have seen all the agencies which are registered then. So we have identified the projects, we have linked up the project with the agency which were working on those. Next slide. So in that case, it was really easy. Right now, we are finding again it's very difficult to identify an agency which can work for the particular project. So then this was an ongoing project for BDL, the midday meal, which we have taken the support of the renowned agency, no doubt, the Akshay Patra Foundation. This is one project which is going from 2010 on, a few donated vehicles for them, and we have supported for the kitchen. And school students were supported in this activity. We thought this we can take up in Nalgonda. But Nalgonda being far off, the midday meal support is not being extended by any agency. So there we were held up. The agency is Akshay Patra is doing in Patancheru, and they have started in Medak. Those areas, they are able to support us. So comfortably, we have chosen them. This was a good project we wanted to do. So this we have chosen Akshay Patra, and we have one unit in Bhanur. So we have taken Patancheru area, and we have catered to the food need of the school children. The next slide. These are all the vehicles what we have sponsored to Akshay Patra Foundation. And they are very well versed with the equipment system. Always they are doing it in extremely scientific mode and hygienic way. Next slide. So schools, children were continuously being supported by BDL. From last 5 years, we are doing this project. And only thing is, we wanted to spread this project, but we are not able to identify an agency who can support us in whole and soul mode. Next slide, please. This RM has come, and we have given one more vehicle to Akshay Patra. Next slide. And here, the same lines I was telling you, in Nalgonda, when we have identified, our colleague is also here, Mohammed sir, who is from HelpAge India. So when we have identified health, immediate name which you could is HelpAge India. You can take the help of HelpAge India, and they will support you in the medical need. They were running it extremely, they are doing a very good job for the elderly people. Nalgonda, if you go to Chowtuppal, Narayanpur Mandals, these were the areas we have chosen wherein there was no medical aid. RMO, some small units were there wherein doctors are not available, and the remote thandas. You see, it's hardly 1 hour journey from Hyderabad, but still to have the facility, they don't have transportation, they cannot come down to Hyderabad, and with a small thandas with 50 to 75 population. They cannot come out of the thandas, neither they can take any medical aid. At that moment in 2012, we have signed an MOU with HelpAge India, and the mobile Medicare unit is being established, a complete set with all the facilities and with the doctor and the complete team, driver and the team, and they go around all the thandas. We have identified 20 villages for this activity. And Akshay Patra HelpAge India have a schedule to go around, a weekly schedule. They make it to cover all the 20 villages. And they give the medical aid at the local places. All the elderly people are covered, including elderly people. If some children and women it's required, immediate assistance is also extended. So what I'm saying is here, the agency support is very much essential to the organizations. Budget is allocated as per the requirement of the government norms. We allocate the 2%, we put it aside. We identify the projects basing on the need assessment. We know what is the requirement local areas, but who is going to support us? Organizations are not there. We have our own specialization. We work for different areas. Here we need a support from the other sector who are already expertise in this. So who are those agencies? The matching is a little bit gap is there, what to my knowledge, which should be attached to organizations so that we can identify good agencies. Here this project, 1800 population earlier in initial days they were doing, and now we are covering around 2000 plus elderly people. Next slide. We have, this is the medical unit which go around, and they, at the local places, they have the centers, they go around and extend the medical aid. Next slide, please. And small, along the support of HelpAge India, cataract operations are also being held, and that's all the same area. Nalgonda we have chosen for this activity. So what are the requirements of that area? We were taking the help and we are covering them. Next slide, please. And the basic requirement of Nalgonda is because of the fluoride affected area is the drinking water. The water, even the groundwater is at lapse, and drinking water, it's horrible. So when we have checked with local people, they said they don't have water, and some tins are being given to them, which they say it's a drinking water. They are charging some amount, and they don't know whether that's a pure drinking water or not. So then again, a question for BDL, like whom we have to take the support in this. Again, only the help we had is we gone to register tests, then in 2011 to identify who are all in water. Then we have identified Nandi Foundation for supporting us in this activity. Here one point I want to tell is, water is a requirement of the local area, we know. But to what is the expectation of the locals, that is very much grip of it what we have to understand. If you provide water as it is, if water is not there, we just provide water, that will not really solve the issue. We really need to understand the basic requirement in depth of the area. So when we have identified this water, even the usage water is not there, drinking water is not there. If you are going to provide water, they are going to use it for all the purposes. If drinking water is to be supported, then we have to specifically identify a project which can meet only the drinking requirement. It should not be wasted to other areas. Then we have done all the ground geographic survey. Then it was very difficult to find the location where water was available. It took 4 months for us to identify the locations where water is there. Though agencies specialized, going there, getting the things done is really a hectic task for us. Then they have identified some 3 locations where they could say some water is there. Again, we need the support of government. Government assistance is required, because that area to be given to a party and an organization where we want to put our bore wells. Then pipeline connection is to be given up to the village area. These are all the practical problems wherein not only the organization, I'm saying that agency, the government support is also equally required, and also the support of the locals. Then when we are coming with the drinking water, they are saying we don't want drinking water. Some water is coming to us, we are already using it. We want usage water, we don't want drinking water. Then we got that water being supplied to them, tested at the local places and shown them this is not the drinking water what you are getting. This is what is the level of water content. To explain them, it took some 2 weeks of survey and to probe into their needs. And we have explained all the family members, the water we are getting is this is the quality. Then they could understand that they immediately said we want drinking water. Then these 3 bore wells were established at places called Narayanpur, Jangaon and People Pahad. These 3 units were supplying to the nearby some 25 to 30 villages. So here a problem was, because water was not there, we cannot give water at free of cost. If you give water at free of cost, though the organizations can afford and agencies can provide, the usage will be 100% at loss. That assessment also organizations have to see. It should go to the immediate requirement of the individual. So we have started charging the value for water.